I wish I could remember this study, and if somebody that's listening can find it, please send it to me. But I recall a study from many years ago that, and maybe you know it, the number one outcome criteria for improvement in therapy was the client adopting the symbol system of the therapist. That if they started to describe the world in the therapist's terminology, like if you were dealing with a therapist that was really focused on the inner child, for example, that when the client began to describe their world, their experiences in terms of the inner child, and they started to use that symbol system in describing their perceptions and experiences of the world, that those therapists were more likely to say, this patient is ready for discharge. This patient has made progress because they had adopted the therapist symbol system.
Right.
And so therefore they must be better. They see the world the way I see it. And it was a very critical article that was saying that shouldn't be the outcome criteria.
Right.
That really impacted me at the time, and again, was not client-centered. And of course, it's always difficult. I think, I haven't been in private practice for a long, long time, but it was always difficult to have clear outcome criteria as to whether or not somebody was ready to move on, ready to end therapy, transition out, or to something else. I think, if you work in depression, you can use a Beck inventory. There were things you could use that were more objective than others, but it was difficult. But if you've injected yourself into it, there's so much subjectivity. I don't know how that's not contaminating the situation.
Yeah, that's such a great example of bias can come in subtle ways. It doesn't have to be just that the therapist is an activist. And I think there's lots of therapists who impose their values that way. They think they're helping the patient, and they don't realize that they might be, for example, demonizing the parents, or turning them into a victim, or not valuing autonomy or initiative. And that those might be the therapist's values. And they're cultivating them in the patient, and they're not even aware they're doing it a lot of the time.
Yeah. I always tried to focus on evidence-based therapies when I was doing therapy, but it's not wrong to have some of your personality, life experiences, beliefs, humanize the experience with a patient. You can't be totally non-human in the experience. Some of that's going to come through all the time. Fair?
Yeah. Yeah. And no therapist can agree with all their patients on every issue. That's not achievable.
Right. Even if it is against your values, sometimes you have to, I guess, agree to disagree. And it might not be a therapeutic issue. It may be something you don't like about that patient and the way they are. One of my best friends is Steve Harvey. You know who Steve Harvey is?
Of course, yeah.
Just a prince of a guy. I mean, he's such a stand-up guy. He has a ranch down in Georgia, and we just shot a special down there on Father's Day where brought in like 250 young men that don't have fathers and don't have role models, even male, strong role models in their family. And so we bring them in for 3 or 4 days and really try to give them a reference point about men, what men do, how men treat women in their life, how men approach work, how men, just give them a role model of how to behave.
All the men at this camp are men. There are no women supervisors here. We just ask that you stay respectful. But now in exchange, I'm gonna give you the best time you ever had. We just gotta impart discipline is the first thing we gotta teach you. Discipline is doing what you have to do, even if you don't want to. That's the first thing you gotta learn. Let's go, baby, let's go. This is what I live for. This is what God made me for, man. I'm living my purpose. All that fame and fortune, it was for this. So I could teach somebody else how to do what I did, or at some level of it.
We bring in a lot of military guys, and here's some of the footage from this, them coming into the camp, and a great bunch of kids, and you see the military guys. They just have so much fun, and they fish and do a lot of things. There's Steve in his hat. But the interesting thing is about 500 yards up the road, not even, is a headquarters for the KKK. Right up from Steve, right up from Steve's gate. They jack with him all the time. They try to block his gate and all of this stuff. And one of these guys, that's, I guess, I don't know if they still call him Grand Wizard or whatever, just harasses him all the time. And when he was telling me about all this, I was thinking what I would do as a therapist if the Grand Wizard of the KKK came in and wanted to see me as a patient and had problems raising his kids or something and started talking about all these things. Is there a point where you say, look, I'm sorry, but I can't do this. I can't get square with you. You're not coming in here about getting better at KKKing, but the things you're talking about, I can't get my head around this.
Sure. I mean, another example is like therapists that work with pedophiles.
Yeah.
There's therapists that work with murderers, terrorists. That work is not for everyone. I think there's a very specific type of therapist who can do that work and do it well. And I do think everybody should be able to get mental health care, but most therapists, I think, aren't cut out for working with some of those groups.